Hello, thank you everyone for joining us today. I'd like to introduce Melinda Richter, Global Head of J-Labs, Johnson & Johnson Innovation.
Oh, nice to meet you all.
So one thing, I'm always interested in talking to people about how they get into healthcare. And you have a technology background.
I do.
There was a personal experience that motivated you to get into the healthcare and life sciences space.
Yeah.
So what was it that kind of interested you in this space?
Well, I don't know if it was that I found something that interested me. Rather, I was propelled into the industry. So back in the 90s, yes, the 90s, the it thing to do was to get into the tech industry. And so I did. I went to a global telecoms company in a fast-track program where you rotate into different roles and different business units and different geographies around the world with the express intent to be a president one day. So I started out in Canada, I was in Calgary, went to Toronto, went to Raleigh, North Carolina, went to London, England, and then I was in Beijing, and I thought I had the world by the tail, until one day I was bit by a bug, like literally bit by a bug. Within 24 hours, I landed in the International Health Clinic. I wasn't feeling so hot. And the next day, the doctors came in and said they were really sorry, but there was nothing more that they could do for me, and that I should call my family. And there's something about that conversation that happens in your head at night when you're not sure you're going to wake up the next day that changes you. And I was struck by the irony that here I was, we were trying to figure out how to order sodas from the vending machines with our cell phones, and yet you cannot take a blood test and figure out what I have? How is it possible that all this money and press and talent is going over here to something that now seems so frivolous when a pretty basic human healthcare gap existed? And so I vowed that if I got the chance to stay here on this planet, that's what I would dedicate my life to, is investment in advancing healthcare. And so that's what I did. I quit my very comfortable corporate job. I became an entrepreneur. Nobody was going to hire me in the healthcare industry to do innovation. But we created a new model to help innovators who had great ideas to progress them very quickly, because in the life science industry, it's very risky, it's very time intensive, it's very capital intensive. And so at the time, who in their right mind would put their time and their money into a life science company? So we tried to make it a much easier value proposition, cheaper, faster, and a smarter way to start companies in healthcare. And that was the beginning of J-Labs. It was another version, it was my own version, and then I met J&J. And with their global scale and expertise across pharmaceuticals, medical devices, and consumer health, and with my entrepreneurial model to help entrepreneurs like you guys propel their innovations forward to the market, we created J-Labs. We're now in 13 locations around the world. We have over 650 companies. Those companies, of the data that's public, have raised more than $25 billion worth of deals in both contingent and secured finance. It's amazing, right? In a 5-6 year period of time, that was unthinkable before. And now we're helping people be heroes in their own hometown. And let's face it, healthcare affects us all differently. And so what we want to do is help innovators in their regions come up with solutions for their community.
And what is unique about J-Lab's approach to innovation and the way that the incubator program is designed?
Well, you know, it's all about finding the best innovators around the world. I call them the rock stars. Who are the rock stars? And listen, yes, they're the serial scientific founders who've been there and done that, and they have a great track record. But then there are all the talented people who've never done a company before, but you have a deep passion for what you want to do. And that's what I think is so valuable about people coming from the tech industry, is that you have a different lens, you have a different skill set and capability, and there's such untapped potential in healthcare yet for technology to infuse itself and make it so much better. My goal has been to techify the healthcare industry. And back when I went in to do it, which is like, you know, now, end of the 90s, 2000, it was a big no. Everybody in healthcare was very suspicious of technology. And now we're embracing it. And this is a great opportunity for innovators around the world. Whatever you're passionate about, however healthcare is, or life and death has touched you, take that experience and turn it into, how can I make that better? So for example, one of my team just found out that he has a very rare form of skin cancer that's lethal, and it's very aggressive. And he, we know all the best doctors in the world, and yet his struggle for care is unbelievable. And so I told him to take on this experience, learn from it, and then come back and just redo it. Just blow that whole solution out of the water and create something that's actually going to work for us as human beings who want to have not just therapeutic, but care all along the way.
And JLabs has been described as a no strings attached incubator program. So what do the startups get out of it, and how does J&J benefit from it?
Sure. So at a JLabs, so the first thing we want to do is create community and skills and knowledge and capabilities in a region. And so we do lots of educational programs and networking events and funding series so that we can help orient people to where are the biggest areas of unmet medical need or healthcare need, and what are the solutions that are possible, and bring people together so that they can connect the dots. And then as they have their view is of the best solution, they would apply to have the same platform or resources that we would typically provide for our internal R&D team. So in a site, let's say in New York City, we just opened up a site in Soho, and it's 30,000 square feet. It's filled with millions of dollars of capital equipment that any biotech, medical device, consumer health company would need to get started without them having to pay for it. And then you can come in and rent something as small as a bench space, one bench, 5 feet, and you can put it on your credit card like a gym membership. And then you can start working on this great technology. And then we have support teams, resources, capabilities. Every company gets a JPAL, somebody within J&J that's an expert in your space that can help guide you along the way. Our goal is for you to be successful, and if you're successful, we're successful, which means we have a no strings attached model, so you can do deals with anybody you want. You could do a deal with Abbott. You really want to do a deal with us instead. But you can do a deal with anybody. What we want you to do is to reach the patient. We want you to reach the consumer, and if they win, we all win. Now, along the way, I hope we get to know each other better, and I hope that you see that we're part of your team, and I hope you'd want to do a deal with us, but that's it, Listen, it is tough to do work in this space, and it's so important. One of the things, some of you may have had this experience, and everyone will. At the moment you think you're going to die, you ask yourself this question: have I lived my life well? I would do this as an experiment. Close your eyes one day and imagine you're not going to wake up the next morning. And ask yourself, have I lived my life well? And when I look back, when I answered, had to answer that question for myself, I only knew what I knew at the time, and now that I knew something different, I had to change my life. And you all have an amazing opportunity to make a difference for people and make money from it. That's not a bad thing. This is a great opportunity for us to really impact people's lives in so many different ways. There's artificial intelligence to make drug development much faster and more precise, and matching the right people with the right therapies, which is amazing, right? When you think about how many people receive care or treatments that make them sick, and it's not going to work for them anyway. We don't want that. Where we want people to be able to access care wherever they are, however they need that to happen, where they need support applications, or whether they need the sensors, right? We have this company called Analytics for Health. This is an idea of prevention. Prevention is so important. This company takes thousands of biophysical measurements to recreate a 3D digital image of your heart. And it follows your heart as you grow. And it can detect 3 years in advance if you are symptomatic of pulmonary hypertension. Now today, when you're symptomatic, when you show you the regular physical signs of pulmonary hypertension, you have 7 to 9 years left to live. That's it. Now, if you can detect it 3 years in advance, you can get on the right medication and live a long and normal, healthy life. That's what we should be shooting for. That's what healthcare should be about. It should be about well care, not how do we manage being sick. So that's the opportunity.
Right. And you mentioned in the past that one area that is really in need of innovation is preventive health. But what are some of the barriers to driving innovation in that area? And can an incubator program like JLabs try to help to address those barriers?
Sure. I mean, so what's the issue with prevention? It's usually things like diagnostics and detection, right? How can we determine early on before you get sick so we can prevent it or intercept disease? Now, the problem with diagnostics is it's not a good business model. When you think about the healthcare system and how it works and reimbursement, you don't get reimbursed very much for that. And so most people don't even get into that industry or that subsector of the industry, even though it is so important. And here's what I say, let's take a page of the book from the tech industry. I don't know, many of you remember back when Google got started, everyone was like, how are they gonna make money, right? What's the search thing? And you don't have to pay for it. And what they did is said, what is the customer looking for? How do we deliver it? And then we figure out how to make money. And that's what I would say to people what to do today. So for example, there's a company called Grail that we have an investment in. It is a blood test. And in this case, it's for 11 different cancers. It's got a high degree of specificity, and it can tell which tumor site it's coming from, and they can do it much earlier, so we can intervene much earlier. And the big question everybody has is, how are they going to make money? Well, you know what? We're going to figure it out. And part of that is why it's important to work with a healthcare company like J&J, because we understand the regulatory requirements and the policy and ethical issues. And so what we want to do is work with you to figure that out. That is the next frontier for us, because the things that are actually the most important to do in healthcare, there's a big black box around it. How do we make money off of it so it can be sustainable over time? And that's where we'd love to partner with you to figure that out.
Yeah, it sounds amazing what Grail is doing. And the startups that are in the incubator program, I'm sure they're working on some really cool, innovative things. You gave one example a few minutes ago. Are there any other examples you can give of some of the innovations and discoveries that are being worked on?
Sure. So we have lots across the different spectrums of health technology. So in drug development, we have this company called Envisagenics out of our New York site that is working on how do you understand the data and the trends on RNA splicing so that we can have for their goal is if you go into the doctor in the morning and they say you have, prostate cancer, by the end of the day, you'll have your own personalized treatment for your cancer. So that's very exciting. We also have a company called Certidose. And so again, there's high-tech stuff that we've been talking about, how do you deal with data, how do you do with sensors, but there's also low-tech stuff. So there's a company called Certidose. It was started by this young man who was an ER doctor, and one of the things he was deathly afraid of was making a mistake in that pressure-filled situation that would cause harm to a patient, especially a child. And one day there was an incident where he and a nurse almost overdosed a child. And when he studied the problem, he realized it actually happens a lot. So more than a classroom of children every day die because of medical dosing errors. You know that? It's a huge problem. And so he decided that he was going to come up with a solution. So he looked at, what is out there that exists today. And there's this international coding system for children by color that each range, a whole segment of ranges of weights are a different color. And actually when you get in the hospital, it's supposed to happen where you get a wristband that tells you what that weight is of the child by that color. And he's like, well, why don't we put that color coding system on syringes, and therefore you can only go within that color code on the syringe for that child based on the color on the band. And it's a very simple thing to do. But it's amazing. They did a study compared to normal statistics of when doctors and nurses administer this medicine versus without it to when they have with it. It's amazing. You go down to absolutely zero errors. That's low tech, but it's amazing what you can do to save a life that way. And so there are so many different opportunities, whether it's high tech or low tech, to make a difference where you can really impact lives.
Sounds great. It sounds like there's a variety of innovations being worked on, so that sounds amazing.
Yeah.
The most recent JLabs location, which I believed was announced last year, is going to be at Children's National Health System in Washington, D.C.
Yes.
You're partnering with that health system on their research campus.
Yes.
And I find it very interesting that JLabs is focusing on pediatric health, that partnership. What motivated JLabs to want to partner with a pediatric health system?
Yeah, a very good question. Well, again, when you want to say, have I lived my life well? The people at Children's National came to us and said, listen, there is a big underserved patient population called our babies and our children that don't have a lot of therapeutic solutions or device solutions, and it's because it's very complicated. I mean, imagine if you have a child, how many of you want to sign up your child for a clinical trial? Unless they're facing a death sentence from a disease or a very debilitating disease, most people don't want to subject their children to that. And similarly, from a corporate perspective, there's a lot of liability associated with that. And yet we still need to do it. We still need to step up to the plate and be bold and try. And so they approached us about creating this integrated campus where you do research and care and commercialization together. So they were gifted the old Walter Reed Medical Center, and they wanted to regentrify it back to its original purpose, to serve patients. And they asked us if we would do a JLabs alongside of them. And so we've done that. We signed a partnership. There's going to be a genetics institute there, rare diseases institute, a device institute. Virginia Tech's going to be there. There's going to be lots of engineering. FDA, NIH is going to be there. We're all going to be there together for the kids. And that's going to be a really exciting way to see from bench to bedside how we can revolutionize care. And it'll be broadly applicable for many different patient populations, not just our babies and our kids. And sometimes it might start out with adults and then go down to kids. So, it really spans the gamut, but it's about saying this is important. We also formed a partnership with BARDA. BARDA is the counterterrorism unit for the United States. They develop medical countermeasures against biological, radiological, nuclear, chemical attacks, and pandemics and epidemics. And they're frustrated because they can't get enough innovators to partner with them because it's too expensive to partner with the government. They did a survey. It takes, on average, about $1 million to negotiate a contract with BARDA. So many innovators can't do it with them. And so we're going to be the translational arm from innovators to BARDA. So we're going to have a medical countermeasure innovation unit there as well at the Walter Reed Medical Center to focus on innovations that will, help guard our citizens against these terrible threats. And then together, we're going to hopefully make a difference for many people around the world.
Sounds great. Now, within healthcare and life sciences, there is an ongoing challenge with a lack of diversity in leadership. How is JLabs using its incubator program to try to tackle that issue?
Sure. You do what you measure. And we measure how many women and ethnic minorities are leaders in our companies. And as of our latest statistics, I think 30% of our CEOs are women. And that's compared to an industry average of 1%. And 29% of our CEOs are ethnic minorities compared to an industry average of 8%. And so our numbers are showing that it's working. And listen, it's hard to design solutions for a patient population if you're not part of that patient population, right? So we need our leadership to reflect our population that we need to serve. So it's important to have diversity. And so we're really passionate about it. We do many things so that happens. When we have panels, for example, we make sure it's an equal representation of diversity. When we have an investor hub in each one of our JLabs. We have investors there that not only look and feel like the entire population, but they also have focuses on serving those different populations. And we combine our investors and our communities around the world. So we just opened in Shanghai. There's a lot of investor dollars in China. And there's a lot of companies who become global, even at a very small scale. Then they realize there's huge patient populations and therefore a business opportunity in places like China and India, where I think by the year 2030, it'll be 550 million people between China and India alone with diabetes and obesity, and that are obese. And that 66% of the world's middle class will be in Asia by, I think it's 2030. I mean, think about that. 66% of the world's middle class will be over in Asia. I mean, things are evening out around the world, and we need to take that into account, and therefore we need to pull innovators from every walk of life that can actually serve all of those different patient populations.
Well, unfortunately, we are out of time, but it's been really great speaking with you, Melinda.
Yeah, thank you for having me. Thank you.